Welcome to Beauty Unveiled. I am Dr. Angela Sturm. I'm a double board certified facial plastic surgeon in Houston, Texas. And here we talk about all of the nuts and bolts, the nitty gritty of how do things work in facial plastic surgery. Today, we're going to ask, what is the ideal age for a facelift? And I actually love this question right now because the answer has changed from the time that I started practice over 10 years ago to now. Whenever I first started, you would say maybe 50, but usually between like 55 and 65. And the answer is when you get to the point that your skin has become lax enough that you can see enough of a jowl, you can see enough of the neck skin that when you lift it up, that makes a big difference. That makes enough of a difference for you as a patient and for me that we're like, yeah, that's worth it. That's worth doing this and we're going to see a great result. And over time, the ideal and the way people look at this has changed. It's also part of like our whole industry because the industry at the time was saying, oh no, wait and put it off. Our facelifting techniques were not quite as advanced as they are now. It was definitely better. There were definitely good facelifts, but the ones that people are doing now are amazing. Like you see incredible results where it's so good and it's something you can do on different ages, and we're not as worried about having tension on the skin because we're taking complete tension off of the skin with the deep plane facelift. Your incisions can heal in a way that I'm comfortable operating on a young person who's going to heal differently than an older person, and the older you get, the incisions heal better and better because it just fades into the skin. We're also comfortable operating on people of all different skin types, which was different from before. You know, you would say, oh, only the lighter skin people will really benefit because you're really worried about the scars. And so now our techniques have gotten so much better that has widened the range of who we feel comfortable doing facelifts are and who we can say, yeah, I can get you a really good result and you're going to be glad you did it and I'm going to be so glad you did it. And the other thing that has shifted is our mindset about surgery versus non-surgical interventions, because I think from the beginning of time we've all looked at ourselves in the mirror and done the lifting up with two fingers thing and saying, yeah, that looks better. That would definitely look better starting, I don't know, around 40 maybe, for all of us. And so I don't think that we are displeased with these things at any different point of life, but I think the way that the industry has thought about it and presented things to patients and the way the patients are educated is different, which is better. I remember people saying, oh, you want to do all these non-invasive, non-surgical treatments to make your skin healthier. So when you do have a surgery or you do have a facelift, it's going to be that much better. But as we know now, that's not necessarily the case. You're actually causing scar tissue in your skin and in the muscles, making it at times harder. And so doing these non-surgical treatments, I think, are great if you're not going to do surgery in the next 5 or 10 years. But if you are, hold off. So the philosophy is different, and the philosophy is different of, oh, do injectables and do Sculptra and do, microneedling with RF and do this all the way up to where that isn't getting you a result anymore, and then go to surgery, that was the last result, that last resort that you should go to, that's the way that we thought about it. But that's not how we think about it anymore. It's more a either or a both together, whereas before it was a linear kind of a thinking. But now it's more of you start Botox whenever you feel like that's something that's going to be beneficial to you, because that's going to work in conjunction with anything you decide to do. Take care of your skin, do skin treatments that are all more superficial, like microneedling, like peels, things that are going to make your skin look amazing. And then whenever you have enough of that skin and the muscle here along the jawline and the neck that you're like, okay, I want to do something about this, and you can see enough of a difference, you are a candidate for surgery. So that shifts our mindset from being in that 55 to 65 range of the middle of the bell curve down to that late 40s, early 50s of being a surgical candidate. And from a medical perspective, you're a better surgical candidate. You have less medical problems. You're probably going to do better with anesthesia. You're going to recover a lot faster than you are whenever you're 65 plus. There are even some medications that we say anesthetic wise, let's not do those, and that category because they have more side effects. So you are a better surgical candidate from that aspect. And then also we're able to get a really amazing result that is dramatic to the patient and to me, but if someone else looks at them, they can't tell that they've had surgery, which is the absolute ideal, because you're still young, you look great, you are supposed to look great, you looked pretty good before, and now you look amazing, and so no one is going to look at you and go, whoa, did you get a facelift? But if your neck goes from your chin down to your chest and then all of a sudden you look 20, they're going to say, who did your facelift? You know, so our mindset in the industry and as patients has shifted to a much younger demographic, which has benefits in many different ways. Am I saying every 40-something-year-old should get a facelift? Absolutely not. Not everyone is there. You know, not everyone is going to be there, but there are people. It's going to be less time and money and downtime and all of that if they say, you know what, I want to go ahead and have surgery, and then they can enjoy that for a really, really long time. And that does not exclude all of the non-surgical things. Then once you've done that, if you do the icing on top with the non-surgical injections and skin tightening, even better, results even better. So those things can work conjunction and work together and to get you that best result that lasts for a really long time, that people can't really put their finger on exactly what it is that you've done. And I think that's the ideal, and I love the place that plastic surgery is right now, that's where we're at, and that's what we're able to deliver to our patients, and then that's what our patients are wanting as well. So let me know if you have questions about this. Please like, share, follow for more information, and you can find me at www.drangelasterm.com, and you can either email us or call us for a consult.